Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Winning.
And I'm Dr. Paul Zalzal. And
I'm Jamie. I'm a registered physiotherapist at Restore Physiotherapy.
So today, Paul, we're talking about maybe one of the single most common musculoskeletal problems that exists in society. Some people say more than or up to 80% of people will have this problem in their lifetime. Jamie, do you ever see people in the clinic with back pain?
Never. No, I'm just kidding. We see it all the time, and it's everybody. It can be any age, any gender, it doesn't matter.
to a certain degree, it's almost not pathologic. Like, it's almost not like
so common.
It's so common that it's like, okay, this isn't pathology, this is just life to feel some pain in your back. Of course, in many cases it is pathology and there's a problem. And of course, if you do have back pain, you should definitely tell your doctor about it, get it worked up, make sure it's not one of the bad things that can cause back pain, because there definitely are some things that you really want to not sort of gloss over or miss, right? Sometimes there's tumors, cancers, fractures. There are some significant deformities.
Yeah.
That's right. There are some things that are bad, but the majority of the time, back pain is something we call mechanical back pain, and it's something that we really don't have a great way to treat, but we have ways that can help alleviate the pain to a certain degree.
Yeah, so we're going to go over Jamie's top 3 or 4 exercises that you can do to try to help reduce your low back pain and just maybe live a life with a little less pain. Okay, where do we start?
Okay, so we're gonna lie down on your back.
We're going to transition to
Okay,
the
here
back.
we are. We have Dr. Weaning lying down on the examining
I'm not getting a
table.
root canal, am I?
No.
Okay.
But with the artistry of camera work, I can make it look like you have really big feet.
Like Frodo.
Like Frodo.
Okay, nerds. All right. All right. So we're gonna start, and we're gonna bend your knees.
Okay.
And you put your feet on the bed.
Okay.
All right. And what you're going to do is we're gonna start with a posterior pelvic tilt. So
Okay.
this is just a way to introduce some very gentle movement into the back, get it moving a little bit without putting too much pressure on it or in a weight-bearing position.
Okay.
So what you're actually going to do is you're gonna gently, really just squeeze your glutes, your buttocks muscles together,
Yep.
and gently push your lower back down into the bed. So it's a very subtle movement.
Okay.
Okay, you're gonna pretend there's a blueberry or something in there that you're trying to squish into the bed.
Okay, that would be weird, but
Yeah, I know, it's very odd, but you're gonna hold it for about 3 seconds or so.
Yeah,
and
okay.
All right, so you're gonna do about 10 repetitions of these and hold each one for 3 to 5 seconds.
Okay.
If you feel comfortable pushing a little bit more, it's completely up to your pain tolerance level.
How's that blueberry coming, Dr. Weaning?
It's jelly.
Should be squish. Should be
This
jam.
blueberry jelly tastes a little off.
Okay.
Do you think some people would have difficulty even lying in this position sometimes?
Sometimes,
because that can be a
yes.
challenge, right?
Yeah, sometimes. You can also do this with your knees more or less bent.
Right.
Or if it's more comfortable for you, you can actually put your feet up on something.
Oh, okay.
Okay, and
Yep.
still perform this exercise.
Okay.
Jamie,
Yeah.
so is someone doing this at home, like on the floor or on a firm mattress?
Oh, I probably wouldn't recommend the floor because you might not get back up again, but maybe a mattress or a couch.
Okay, so like
Okay.
something firm, or is it you can do this on like a soft type?
You can do this on a soft mattress if it's comfortable. If your couch is more firm, then definitely do it there.
Okay.
So that's exercise number 1.
Number 1.
Exercise number 2
Yep.
is just going to be what we call a single knee to chest, okay?
Okay.
So you're actually going to grab one of your knees with
Yep.
your hands and bring it into your chest and just pull as much as you feel comfortable.
Should my other leg remain bent or could it be flat?
It should be bent or
Okay.
flat, whatever's more comfortable for you. I know
Okay.
that's not really an answer, but that's fine.
Yeah, so whatever
Okay.
within the limits of your comfort.
Yeah.
Okay.
And you're going to just pull as much as you feel comfortable. Hold it for about 5 to 10 seconds,
Okay.
and then you're going to relax it down again.
Okay.
All right. And then you can keep doing that side, or you can switch back and forth.
Okay.
Doesn't really matter.
And you're going to feel some of that even across your hip too, right?
Yes.
Your hip flexors kind of get pulled, your capsule's a little bit tight,
Yeah.
and then the back as well.
So we're really encouraging just stretching out the back muscles. So all those ones up through the spine and into your hip, and your glutes even are probably going to get a little stretch there.
Yeah, you can feel some.
Okay.
Yeah. Okay, that's good.
All right, and it just encourages some gentle movement again.
So you do same thing 10 times each side, a couple
Yeah.
of sets?
Yeah.
Okay.
Okay. If you can't do 10, that's fine. Maybe just 5 or so.
Okay.
All right. The last exercise is going to be just knee rotations or hip rotations, whatever we want to call them. So you're
Yep.
going to bend both of your knees and put your knees together.
Yep.
Okay. And you're just going to very gently lower both of your knees to one side.
Should I have my hands flat on the floor of the mattress or wherever?
Flat,
Okay.
yeah.
Yeah.
Okay. And as when you feel that you can't go any further or you want to stop, then you stop and you hold it for a second or two, and then you come back the other way, and then you lower your knees to the other side.
Okay.
Okay? And again, just hold it for a second or two and then back up. So this is, again, just encouraging gentle rotation through the lower spine, lumbar spine. Okay, gets your hips. It's going to stretch down the sides. All right.
Even in your core a bit, for sure.
And in your core, for sure, because a lot of the time the muscles are very, very tight, and they just want to be stretched a little bit, very gently. Okay. If you have a hard time bringing your knees back up to center, you can put a belt around your knees and pull it.
Oh.
Okay, with your hands.
Okay.
So if it's difficult to bring your knees back up, you can assist yourself by putting something around your knees and holding that in your hand and just pull it. Okay?
Oh, that's a good idea.
All right. So those are usually the 3 exercises that we recommend to people.
That's where you start.
Very acute back pain.
Okay.
Right.
And often it can be uncomfortable, right? So
It's incredibly uncomfortable.
that's why they go slow, they do low
Yeah.
numbers, and that's why they're not doing any crazy things.
Exactly.
So a lot of people will look and think, if you don't have a back problem, you think, oh, this isn't really very much.
Yeah.
But that's why you're not doing it, because you don't have a back
A
problem.
lot of people with back pain can't bend over or walk or
Getting
stand up
onto this
straight.
table would be difficult.
Getting onto the table is sometimes excruciating. So
Okay,
we start as gentle as possible.
That's
Okay,
awesome.
Jamie, that was an awesome demonstration of
you.
just the most important 3 exercises to do if you're suffering from low back pain. Let's go over them. Number 1.
Posterior pelvic tilts.
So that's where Dr. Weeding was lying on the examining table and just sort of squeezing that blueberry.
Yeah.
Can it be a raspberry?
It could be a raspberry if that's your favorite fruit. That's fine.
How about a peach?
It's maybe a bit too
Yeah,
big.
okay.
Yeah.
So we're squeezing those. You did that 10 times for how long?
3 seconds.
3 seconds. Okay. That's number 1. Number 2,
Number 2 was the single knee to chest.
right? Single knee to chest, where he's
Right.
pulling up his knee.
Yeah, just hugging his knee in towards his chest. Very gentle stretch. Hold it for 5 to 10 seconds. Do it 5 to 10 times
Each side.
each side.
And then you have a neat trick. If you can't do that, you can use a belt, or is that later?
Well, you could use a belt if you wanted to, if
Okay.
your arms aren't long enough or it
Okay.
hurts too much, okay? But yeah, the belt is also for the
Okay,
next one.
number 3.
Number 3 was the lumbar spine rotations, where you're lying on your back with your knees bent and letting your knees fall from side to side.
Perfect.
And that one felt good too. You could really feel a nice stretch
Nice
actually in the,
stretch on
in the
the back.
side to side
That's good
one.
to do even if you don't have low back pain.
I would agree with you. And I think notoriously people with low back pain have poor cores. Like all of us have weak abdominal muscles, and it really leads to a lot of low back pain. So yeah, this is a great introduction to help deal with your low back pain.
And remember, if you do have back pain, make sure you get it checked out. Make
course.
sure it's nothing serious causing it. But rest assured that it's very, very, very common for people to have back pain. And these are 3 things you can do to try and help yourself out.
Start off.
Thanks to Jamie for showing us these exercises.
Thank you.
And if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.